The shortage of healthcare workers isn't necessarily due to a lack of interest from job seekers. Instead, a big obstacle in filling those positions is the significant time and financial investment required for training. DFL Senator Liz Boldon's Bridges to Healthcare program helps close that gap, and she joins us now. Senator, welcome to Senate Spotlight.
Thank you so much.
Senator, Bridges to Healthcare was one of the first bills you ever carried in the legislature. So talk to me about what inspired you then and what inspires you now to keep pushing for it.
Yeah, I love this bill. It was, in fact, the very first bill that I carried when I was first elected to the House. And I love it for a couple of reasons. One, it's related to healthcare. It's bringing folks into healthcare careers, nurses and others. And as a nurse, that is important to me. And two is that it is successful. It is a proven program that we have seen over time that has brought successes. People are moving through the program, able to complete their training, complete their schooling, and then get into good paying jobs that are needed in our community. And so it's an excellent program providing those wraparound services to people to be sure that they can get through that training. So it's not just tuition and books, but things like car repairs or childcare, really lowering the barriers for people to be able to get that education and then move into careers that are filling those gaps that we have in our community.
Now, Senator, this program has been in your community for a while, and you said, there are visible successes. So talk to me about what that looks like.
Yeah, it really is getting people into our healthcare careers that are needed. We just talked about, we have, workforce challenges. This is bringing people through the system, bringing people, getting them that training and education needed to get into those good paying jobs that we need to fill. And it's expanding the diversity in our workforce. It really is lowering barriers for people who may not otherwise be able to do that and be able to complete the training and education. And so it really is win-win. It's win for the people in the program, it's win for our community, it's a win for the healthcare organizations and businesses who are getting the folks into the workforce.
Senator, we know the program is growing and it's serving more students than it originally thought it could, so it's doing so well. Where would you like to see it continue going in the future?
Yeah, the program continues to expand. Again, it's proven, it's successful, and other communities are seeing that as well and wanting to take part in that. And so that is part of the bill as it has changed over the years, is to really bring more communities in. I mean, we are seeing, particularly in Southeast Minnesota, communities like Austin and other spaces where they have the workforce needs, certainly related to healthcare, but being able to expand that wraparound support in the program to expand to other communities across Southeast Minnesota.
Now, Senator, another issue I've heard you speak really passionately about is medical debt. What makes that issue so close to your heart?
Yeah. I, as a nurse taking care of patients, this comes up frequently. Oftentimes, I will hear patients and families as they are in a hospital room. At a time when they should be focusing on healing and recovery and getting well, they are feeling overwhelmed because of the costs that they anticipate and the potential effects of that. And so, and certainly have experienced in my own personal life and my family and friends, the really oftentimes devastating impacts of medical debt. Medical debt is the #1 cause of bankruptcy in this country, and that certainly is reflected in Minnesota as well. And medical debt is not like other debt. It is not like a car loan or a business loan, something we choose. Any one of us at any time could, you don't plan for a heart attack or a gallbladder rupture, things like this. And so any one of us could experience that through an unexpected diagnosis or accident. And so it should be treated differently. And so this work is really important to me, just the burden that people feel and the weight that people carry with that. It impacts basically every aspect of their life, and it doesn't have to be that way.
You mentioned that it can impact every aspect of a person's life, but what about the people without the debt? Does it impact the wider community?
I mean, I think absolutely. I mean, and to be clear, this is an issue in every corner of our state. And as I have been working on this, people, come to me and want to talk about it and share their experiences. And what I have found is if you personally don't have experience with medical debt, I guarantee that you know somebody who does. And so it is so widespread. It really is, affecting so many people and impacts how they walk through the world, right? It impacts mental health. It impacts their, ability to, do often kind of basic things in their life, it really is pervasive and carries big consequences for people.
I can also see how it would impact the economy of the state too, just the impact it has on these people. So in October, you had a bill that went into effect, the Minnesota Debt Fairness Act. So take me through what that does to help alleviate some of those pressures.
Yeah, I am really proud of this bill. Worked on it in collaboration with Rep. Liz Boldon in the House and the Attorney General's office. And it was a package. It had aspects related to medical debt and then some aspects related to broader consumer debt protections. But three things specifically I would like to name related to medical debt. One is that it no longer allows the automatic transfer of medical debt from one spouse to another, which is something that was pretty unique to Minnesota. Not many states at all did this other than us, and it was unique to medical debt. We don't treat any other medical debt like that. So just that automatic transfer of responsibility no longer happens. It doesn't allow healthcare entities to deny care to people solely because they owe them a debt, which is something, we heard really heartbreaking stories of families who required care, oftentimes specialized care, that they didn't have access to and couldn't get solely because of medical debt. And so there are provisions where folks need to be in contact and be working towards a payment plan that's within their means, but just the blanket denial of care is no longer allowed. And then the third piece is it doesn't allow medical debt to be reported to credit bureaus to negatively impact people's credit scores, which is really important. And I sometimes get questions about this. That had happened at the federal level and has since been rescinded, but it is still the law in Minnesota, and so that is not happening to people in Minnesota.
Senator, you have another bill related to undue medical debt. What does that term mean, and how will this other bill address it?
So this is a sort of a continuation of the medical debt work I'm doing in collaboration with Rep. Ryer and the Attorney General's office, whose team has been excellent on this. We are working with a nonprofit charity organization, Undue Medical Debt, that has worked with many other states across the country. They are currently working with the city of St. Paul to do the same thing, and it would allow for state funds. The ask is $5 million, which would then they're able to stretch that, and we could forgive $500 million of medical debt for Minnesotans. And this would be low-income Minnesotans. This would be debt that has kind of gone through the process, and folks they're not able to pay it. And again, thinking about just the weight and the burden and the impact that has on people's lives, in talking with folks who have experienced this in other states or in, as I mentioned, the city of St. Paul is doing this right now, it is life-changing for people to have that debt forgiven, and allows them to move on in their life and kind of release that burden and that weight that they're carrying. So it would be life-changing for people. Between 240 and up to hundreds of thousands of Minnesotans could be potentially impacted.
Wow. Can't wait to keep following that one. Senator, we can't talk about medical debt without mentioning some of the other actors in that arena, being health insurance companies or hospitals or other medical providers. Is there anything happening in the legislature, this session relating to them?
Absolutely. There's lots of work going into those spaces as well. A couple of things I would name, and I would mention some of this work started with the late Senator Carrie Dietzich, who was amazing in this space and really fought till the end of her life to be sure that people have the care that they need. So a couple of those things is altering prior authorization, not requiring prior authorization for cancer treatments. Prior auth is often just a barrier to care for people, and so again, eliminating those barriers. She also had a bill that is moving forward that would require coverage for wheelchairs, like mechanical wheelchairs for people to get in and out of. And so, again, just making sure people have access to the care that they need. Another bill I would name that I'm very excited about is Senator Lindsey Port has a bill to create an Office of Patient Protection. The hearing on this bill was incredibly moving. The barriers that are in place for people to access care are great. Our healthcare system is a labyrinth. It is extremely complicated and difficult, and there are so many ways in which there are barriers for people to get care. And so having an office really dedicated to dig into that and look look at that and advocate for people, I think is incredibly important. Two other things I would mention is I've got quite a bit of work around mental health care, making sure that we are, again, decreasing barriers for people and eliminating sort of systemic red tape for providers in ways that, if there are things that are not value add, that we are eliminating those so they can spend more time caring for people. And the last thing I would say is I've got a bill around certified midwives, creating a new path for folks to come into that profession. So I think there's lots of work being done, lots of ways that we can decrease barriers and be sure people really have access to the care that they need. And right now we have a system that is in many ways focused on profits instead of care, and I am dedicated to having that look differently and really being sure that people have access to the care that they need.
Senator, any final thoughts on this issue?
I really appreciate you taking the time to chat about this. I mean, healthcare is a human right. Making sure that people have access to that care is incredibly important. We have a lot of work to get to that, but it is work worth doing, and we are doing it.
Senator, thank you so much for your time.
Thank you very much.